Wound care has existed among various cultures for thousands of years. It is an ancient practice that has developed over time with continuing knowledge. Many people are taught Western biomedical methods of wound care. However, there are further wound care modalities around the world that are practiced. This video will explore Indigenous approaches to health and methods of wound care, and provide an example of wound care from Southeast Australia. By comparing the World Health Organization definition of health and the definition of Aboriginal health, it provides a useful framework for understanding contrasting values between Western and Aboriginal perspectives. The World Health Organization definition often emphasises physical and mental well-being within a biomedical framework, whereas Aboriginal and Torres Strait Islander health definition integrates a more comprehensive view of health, encompassing spiritual, social, and environmental aspects, reflecting a deep connection between individual well-being and community health. Cruz and Lucero's ego versus eco model further illustrates these differences. In Western perspectives, the egocentric approach often emphasises individualism and prioritises human health over environmental concerns. In contrast, Aboriginal and Torres Strait Islander cultures typically adopt an ecocentric approach. This viewpoint values the health of the environment and the community equally, emphasising a holistic connection with the land and sustainable practices that benefit future generations. It is important to acknowledge the diversity of knowledge and practices among Aboriginal and Torres Strait Islander communities. Across Australia, the plants, animals, weather and resources differ greatly depending on geographical location. This means that mobs living and caring for desert, saltwater or freshwater countries will have access to diverse ranges of medicines and wound care practices. Throughout this video, we will explore wound care methods used from Aboriginal communities within Southeast Australia across Victoria. Prevention of wounds can be optimised through education and practices to manage chronic illnesses and optimise overall health and well-being. However, wounds can also be unavoidable as a result of sudden trauma. In this case, there are various treatment options involving both Indigenous and Western knowledge. For example, both cultures can involve the use of medications, whether these are sourced directly from country or from a pharmacy. Once an appropriate treatment method has been implemented, aftercare of the wound is undergone, which again incorporates varying methods depending on which cultural approach is followed. Western and Indigenous approaches to wound treatment may differ in their method. However, both share common objectives. For example, wound care objectives can be to reduce risk of infection, controlling inflammation, and promoting overall healing. Indigenous health principles are rather holistic and have a strong focus on overall prevention of health issues. But as we know, wounds can't always be prevented and are sometimes unavoidable. Aboriginal and Torres Strait Islander ways of knowing and doing have been around for over 60,000 years and teach us natural, effective methods of wound care. In Western medicine, a common way to treat a wound is by cleaning it with an antiseptic, dressing the wound, and if necessary, taking antibiotics to reduce the risk of infection. Aboriginal knowledges tell us that our bush medicine has healing properties to treat wounds too. One example of Aboriginal knowledge for wound care involves the use of honey. Honey is used to hygienically cover wounds and aid in the healing process. Western science has also shown that honey improves wound healing, reduces scar tissue, and is rich with anti-inflammatory and antimicrobial properties. The Gumby Gumby is a tree native to certain areas of Australia and has healing properties to treat eczema. It bears a fruit that resembles a small apricot, but these are not typically considered to be a food source. The Gumby Gumby plant is used for its leaves, which contain antimicrobial compounds that reduce skin inflammation. Modern Western science is beginning to catch up and conduct studies on its effectiveness. Grinding stones have long been used by Aboriginal people to crush and grind various materials, from berries and seeds to insects and small animals, to process materials in preparation for cooking and medicinal use. In this case, the leaves of the Gumby Gumby plant are ground into a paste. This paste can be boiled into a decoction that is taken orally or directly applied onto the skin to treat and relieve eczema. In modern Western wound treatment, it is common practice to cover a wound with a band-aid or other synthetic dressing. There is also Aboriginal knowledge about various wound coverings. Just one example of a wound cover is a kangaroo medicine band. Bandage-like strips are cut from kangaroo skin and used as a wound cover. Sizes of the skin vary depending on the size of the wound. To help hold the kangaroo band in place, native grasses can be woven into rope to tie the kangaroo skin to the wound. Aboriginal people can also place meaningful designs on kangaroo bands to promote healing. In this kangaroo band example, we burnt holes on the edges of the skin to create an opening to insert the rope ties to help hold the kangaroo band in place over the wound. Here we show you how the medicine band was tied over the wound. However, there would be a balm or medicine placed over the wound and perhaps some paper bark over this. The kangaroo band effectively holds these in place and protects the wound. So, which cultural approach is more effective for wound care? No method or knowledge is superior to the other, and it is important to acknowledge one's values and resources available to most appropriately care for one's health needs. You may be lucky enough to meet Aboriginal people who wish to use their own medicines in wound care one day.